just throughout this assessment, I want to be assessing your affect and your mood. Can you tell me your name?
Kristen,
Okay. Tell me where you're at.
at the doctor's office.
Okay. And can you tell me the date?
November 25th, 2013.
Okay. And why are you here?
Just a general checkup.
Okay, good. First, I just want to go ahead by assessing your gait. I want you to start from here and walk towards that wall. Just going to watch her swing of her arms, turn around and see the balance, and walk tandem, foot heel to toe. Very good. Looking at balance. Okay, very good. I want to go ahead and assess the spine. Just want to go ahead and turn around. I can see that the shoulders are level. Go ahead and lean forward a little bit, looking at level, the scapular level, iliac crest. Okay, and the gluteal fold are level as well. Any tenderness of the spine?
No.
And it is straight as well. Go ahead and turn around for me. We're going to do some range of motion. And you do what I do: flexion, extension, hyperextension, lateral bending, and rotation. Good range of motion. Okay. Next, I want to do the Romberg test. This way. Go ahead and close your eyes. I'm just going to check for any excessive swinging. Very good. And I would also be looking at the upper extremities, looking at the skin, make sure it's nice and pink and no lesions noted. Next, I want to go ahead and do some range of motion of the shoulders. Just do what I do. Like this. And that is internal rotation, external rotation, flexion, extension, abduction, and adduction. And do the elbows, flexion, extension, supination, pronation, the wrist, flexion, extension, adduction, and abduction. Do the fingers, flexion, extension, abduction, and adduction. Good. Now I want to go ahead and assess the strength. Go ahead and pull and push. Okay, good. You'll do some D10 reflexes to the elbow. If you just leave your the tricep, if you just leave your arm nice and soft there. Okay. Brachial. Okay. Go ahead and take a seat for me. I'll go ahead and do the knee, Achilles, Babinski, and Clonus here. Here's the knee. Just feeling for the soft part here. Good. Achilles. Okay, good. And Babinski looking for the flaring of the toes. And there's no flaring. And then Clonus, just go back and forth, and up. And Clonus is negative. I'm going to go ahead and inspect the skin. Skin looks nice and pink. Feels nice and warm, dry. Good elastic skin turgor. Smooth texture. Good hygiene. Your hair looks nice and brown. Evenly distributed. Fine texture. Your nail beds are nice and pink. And brisk capillary refill. I want to go ahead and do some facial expressions for you. Can you smile? Frown, puff out your cheeks, show me your teeth, and lift your eyebrows. So keep your eyes closed while I try and open them. Good. And that is cranial nerve 7, facial. Let's go ahead and test cranial nerve 5, trigeminal. And you clench your teeth, feel the masseter muscles, and the temporal muscles. Okay. Just going to do a sharp and dull test. This is sharp. And this is dull. Go ahead and close your eyes and you tell me what you feel.
Sharp, dull, sharp, dull, sharp, dull.
Very good. And and that was cranial nerve 5, trigeminal is intact. Now I'm going to go ahead and palpate the sinuses, the maxillary and temporal. Any tenderness?
No.
Okay. Go ahead and look at the eyebrows, and the eyelashes are nice and brown, evenly distributed. Eyelids are evenly set with no drooping noted. Sclera is nice and pink. Conjunctiva is nice, or sclera is nice and white. Conjunctiva is nice and pink, and cornea clear. Just going to look at your pupils here. Just look straight ahead. Pupils are equal, round, and active to light accommodation at about a 3, and just look at this here. And they converge. Next thing I want to do is, that was cranial nerve 3, oculomotor. We'll continue to do cranial nerve 3, 4, and 6, trochlear abducens. Looking for any extraocular movements, just follow my finger. Good. Next we'll do the cover and cover test. Just look straight ahead. Good. And Hirschberg, just look straight ahead. And Hirschberg is negative with light reflex at 3 o'clock in both eyes. I'm going to palpate the lacrimal glands and the puncta, and no excessive tearing or dryness is noted. Now I'm going to take a real close look at your eyes here. About 15 inches away, I see the red reflex. Come in closer, and I can see the optic disc margins are sharp. Next, I'll look at the ears. Ears look to be evenly set on both sides. They look to be in alignment with the eyes. I'm going to palpate the auricle and the mastoid process. Any tenderness?
No.
External ear canal looks nice and pink. I'm going to take a closer look at the ear. Go ahead and turn it for me a little bit. There we go. I'm going to lift the ear up. Put the ulnar side of my hand against her head and look in. I can see the cone of light, the umbo, handle of malleus, and short process of malleus. Do the Weber test, which is cranial nerve 8 acoustic. Tell me if you can hear on both sides.
Yes.
Okay. This is the Rhine test. Tell me when you can no longer hear it.
Now.
Tell me when you can no longer hear it.
Now.
Good. Air conduction is twice that of bone conduction. And we'll do the whispered word. Tell me what I say.
11. 59.
Good. Cranial nerve 8 acoustics intact. I want to inspect the nose. Looks like it's in midline of the face with no deviation noted externally. Let's test the patency. Breathe in and out. In and out. Okay. Take a look inside the nose. Just want to put my hand up on the forehead. Push her nose up a little bit, back. Use the ulnar side of my hand against her cheek to make sure that I don't stick it too far up her nose as she moves. It's nice and pink, no lesions noted. I can see the inferior and middle turbinates. Take a look at your mouth. You have your lips are nice and pink, moist. We'll take a look inside your mouth. Gums are nice and pink and moist, adhering to the teeth. The teeth are nice and clean, white, no dental caries noted. Assess the tongue, the rest of the mucosa, the hard and soft palate, the tonsils, uvula, and pharynx are all nice and pink, moist with no lesions noted. Next, I want to test cranial nerve 10, vagus. You say ah. And the soft palate rises and falls, the uvula stays midline. Next, I would test cranial nerve 9, glossopharyngeal. I would elicit the gag reflex by placing the tongue depressor towards the back of the mouth and eliciting the gag reflex. Next, you do some tongue movements. We're going to test cranial nerve 12, hypoglossal. You stick your tongue out, side to side. Okay, put it back in your mouth and place it against my hands. Very good. I want to go ahead and assess the lymph nodes in front, preauricular, postauricular, occipital, tonsillar, submandibular, submental. I would be doing these on both sides. We have superficial cervical, deep cervical, posterior cervical. All right, above the clavicle, lift your shoulders for me. Supraclavicular, and below infraclavicular. Okay. On those, I just want to note the size, the shape, the consistency, mobility, any tenderness, and their borders. I want to do the next, the range of motion of your neck. Can you do what I'm doing? Flexion, up is extension, hyperextension to your ears, lateral bending, and rotation. Okay. I want to go ahead and look at the trachea. Looks to be midline of the neck. Looks good. We'll check the trapezius muscle. Lift your shoulders up. Don't let me push them down. Good. Push your head against my hand. SCM is good. Cranial nerve 11, spinal accessory is intact. And to do a thyroid assessment, turn this side for me. My hands around here, identify the landmarks, the thyroid cartilage, the cricoid cartilage, the isthmus. Displace the trachea to the opposite side of where I want to assess. Have her take a sip of water and feel for any masses. And if there's any tenderness or nodules, masses noted, I would auscultate those areas, the thyroid. I want to go ahead and assess the posterior chest. You can go ahead and stand up for me. I'd just be assessing the skin, noting that it's nice and pink, any lesions, and I'd also be looking for any anatomical deformities. I'm going to go ahead and check for fremness. You say 99 every time I touch you. Let's go turn this way.
99, 99, 99, 99, 99.
Good. Take a deep breath each time I touch you. I'm going to listen to your lungs. Good. Just go ahead and turn around for me. Just assess the anterior chest, the skin, making sure it was nice and clean. No lesions noted, pink in color. Go ahead and listen to your lungs. Take a deep breath. Turn this way so I can see. Take a deep breath. Next, I'm going to go ahead and palpate the lymph nodes.